So tonight I'm going to be talking about Milton Friedman and medical licensing. So we'll start off, how many state licenses do you all have? Now, I'm going to say most people in this room probably have at least one. So how many state licenses would you say you have in addition to your Colorado's driver's license? Go ahead and just yell out what you think you may have or you probably know that you have.
I have one.
Go ahead, what is it?
One insurance license.
Okay, what else do you have? Anyone else? Okay, fishing? Okay.
A concealed carry permit?
Okay.
Marriage.
Marriage license, okay. All right, good, good. Yeah, so, divorce license. All right, next slide, Amanda, please. So, I have 3 state licenses, which are the ones listed here. There's my driver's license, my concealed weapons permit, and my license to practice medicine within the state of Colorado. And most people regard government medical licensing as obviously a good thing. It's almost a no-brainer, but not Milton Friedman. He did not. And although there's some issues on which I did not happen to agree with Milton Friedman, as Amanda had discussed, he was really good on this issue of medical licensure, and that's what I'm going to be concentrating on today. So next slide. So I'm going to talk first about Friedman's views of medical licensing per se. I'm going to touch on this topic of licensure and competence because most people seem to conflate the two, and they're actually very different, and I'm going to explain why they're different. And then I'm going to talk a little bit about how medical licensing laws will have an interesting interplay with the new Obamacare health laws in ways that most doctors and most patients don't realize, but they're outgrowths of the sort of things Friedman predicted and talked about. So let's go to the next slide. So first, Friedman's views of medical licensure. Most of what I'm going to talk about is drawn from his 1962 book, Capitalism and Freedom, and in particular from Chapter 9 on occupational licensure. He talked more broadly about occupational licensure as such, and then focused on medical licensure as one category of that. And so he broke his discussion into 2 sections. He talked about the supposed reason for occupational licensure, then he talked about the real reason that nobody ever wants to really talk about. So, of course, the supposed reason, if you ask most people, why should doctors be licensed? Doctors, legislators, the general public, they'll all say, well, of course it's to protect the public. Makes perfect sense. And as Friedman said in that chapter, he framed, the way it's typically framed is, ought we to let incompetent physicians practice? Of course, the answer is, no, we wouldn't want that. Next. And so Friedman, he spelled out the typical pro-licensure argument as follows. He says, individuals are incapable of choosing their own servants adequately, their own physician, or plumber, or barber. In order for a man to choose a physician intelligently, he would have to be a physician himself. Most of us are therefore incompetent, and we must be protected against our own ignorance. And oh my gosh, guess who will jump in to protect you? Okay, next slide. Now, of course, what Friedman pointed out next was the real reason for many of these licensure laws, including medical licensure, is to protect not the public, but the practitioner. And the key to that was already in that first statement, because note, only doctors in theory are supposedly qualified to decide who is fit to practice medicine. So, as Friedman stated, licensure almost inevitably becomes a tool in the hands of a special producer group to obtain a monopoly position at the expense of the rest of the public. Fancy that. So it's basically like the foxes guarding the henhouse, as in that picture on the right. And this is basically how it played out in the United States. Before the mid-1800s, there wasn't really much in the way of medical licensure laws. There are all sorts of different competing groups of health practitioners. MDs, naturopaths, osteopaths, chiropractors. They were maybe good, maybe not good, but there wasn't much in the way of formal licensure. Then in 1847, the AMA was formed to protect the interests of MDs against all those other practitioners. And they started pushing hard, they started lobbying, and they achieved their first real big success in 1910 with this Flexner report submitted to Congress, which essentially recommended shutting down what were substandard or low-quality medical schools and requiring medical licensure. Now, this was done on a state-by-state basis over the next several decades. They pushed and had that implemented into law at the state level, and now we have the system that most of us take for granted as if given, like the law of gravity, that we have state licensing boards that are in effect controlled by MDs deciding who gets to practice medicine and who does not. Next slide. And this quality argument is extremely powerful, even among people who should know better. Just recently, there was a nice story on NPR radio. This is the Planet Money show, which is actually pretty good. It's an economic show, although NPR is sort of liberalish, leftish. They're very good on many economics points. And so they had a nice story on the Institute of Justice lawsuit against some of these stupid licensing laws, such as the hair braiding license that you have to get in Utah. And these women have to go through all sorts of training and certification to braid hair for money. And so the reporter, Jacob Goldstein, made a very good statement. He was very straightforward. He said, licensing rules make it harder for new people to enter a field. It limits competition and allows current practitioners to raise prices. So Jacob Goldstein, he gets it. It's not like he's stupid. He studied economics, he's smart, and he understands exactly the argument, exactly what Friedman would have said. And then in the next breath he said, but I sleep better at night knowing that the infectious disease specialist at the hospital down the street is licensed. So even he, who should know better, still is sucked in by this quality argument. Next slide. And so Friedman made three basic categories of arguments against licensure. And I think they're all excellent arguments. He correctly noted licensure restricts supply and raises costs. And as Friedman put it, the public is deprived of the medical care it wants to buy and is prevented from buying by licensure laws. And he also pointed out, and this is a more subtle point, licensure does not actually ensure competence. So next slide. And so I'm going to kind of focus a little bit more on this sub-argument, the licensure and competence issue, because this is where most people think licensure is doing a good job. And I'm going to tell you a secret. Most doctors know this, and most patients don't really, they sort of understand it. Maybe they don't really want to understand it. But the dirty little secret of medical licensure is you can be a bad doctor and still be a licensed MD. You can be a really bad doctor. And I know from the inside, there are some scary bad doctors that have a Colorado medical license. There are also some very good doctors. And if anything, the state licensure is not a really reliable protector against a bad doctor. There are other private mechanisms that I think are much better. For instance, there's what's called board certification. I'm in radiology. I had to pass this pretty strict test by the American Board of Radiology to become what's called board certified. It's a set of oral and written exams, and it's pretty rigorous, and once you pass that, then you are board certified. You can be board certified in pretty much all the major specialties. Orthopedic surgery, pediatrics, OB gynecology, oncology. Basically all the major branches of medicine have a corresponding private board that certifies them. And that's actually a much better reliable indicator of a good doctor. It's not perfect. I mean, there are some doctors that are board certified that aren't that good, but it's certainly better than mere state licensure. Similarly, hospital credentialing committees do a good job. At least many of the good hospitals have good committees because they don't want a crappy doctor being on their staff because it's their reputation online. One of the hospitals I work at, a Swedish hospital, top tier level 1 trauma center, and one of my partners at work, he's served on the credentialing committee for years, and they try to weed out the bad ones because it's their reputation on the line. I mean, of course, it's the lawsuit and money, but it's also their reputation to the public. They don't want bad doctors. Again, it doesn't weed out all of them, but those are much better protectors of competence than just state licensure. Next slide. And just to drive home this point, there are some truly excellent surgeons in Colorado. The picture on the right, Dr. Steve Morgan, he was the orthopedic surgeon at Swedish Hospital that fixed me when I broke my hip last year. It was a weird fracture. It was a certain fracture type that was very rare, and he said, I've only seen probably 10 of them in the last 10 years, and no one else in the city has seen more. And so when I got rolled into the Swedish ER because of the break, I was really relieved when he was the guy on the top of the call list for orthopedic trauma. I probably would have asked for him if he wasn't, but I was like, phew. Now there's other doctors in Colorado, I wouldn't let them touch me with a 10-foot pole. I'm not going to name names, so I have the picture of Dr. Nick from The Simpsons as my stand-in. But these lousy doctors and these good doctors, they are licensed by the state of Colorado. Next. And the problem is government licensure cannot guarantee quality. That's something I know and I think you should know as well. But what does happen, licensure does lull patients into a false sense of security. And that's the really dangerous part. You're going to go, and I've heard conservatives say, oh, well, he's licensed, he's got to be a good doctor, right? It's like, no, I don't think so. And really, the state cannot protect you from a bad doctor. Only you can protect yourself. You have to do forms of research, get good referrals, word of mouth, visit. There's all sorts of methods, but there's no easy way, just like there's no easy way to guarantee you're going to get a good car or a good plumber. You have to do some work. And there's rating agencies that might help you, and there will be more of that in a fully free market. But it's really on you, not the state. Next slide. So this is today's logic quiz. Spot the logical fallacy. Number one, he's a licensed MD. I'm sure he's okay, right? And number two, he's a licensed driver. I'm sure he's okay, right? Now most people know number two is clearly wrong, but I think they need to apply the same logic and realize number one is equally wrong. Okay, next. And more fundamentally, licensure is a problem because it violates fundamental individual rights. This is a point Friedman made, and I'm glad to see more and more people making that in the popular media. This is a quote from Judge Andrew Napolitano on Fox News from a couple of years ago. He said, "The state has no moral or lawful authority to restrain A and B from agreeing to exchange a service for payment, provided that the agreement is voluntary." I'm glad that something like that is promulgated on a major TV network. Next slide. There's more broadly a good drawing opposition to the concept of occupational licensure. This is a great article from the Wall Street Journal from 2011, again talking about some of these crazy occupational licensure laws all around the country. They called it a license to shampoo, jobs needing state approval rise. And they quoted a paper from 2008 that shows that as of then, 23% of US workers require some kind of state licensure to do their job. And that number has risen dramatically from the 1950s. Now it's 23%, which is astounding. There are as many as 1,100 professions in which you must get a state license in at least one of the 50 US states. And the Wall Street Journal cited as examples florists, interior designers, private detectives, hearing aid fitters, conveyor belt operators, and retailers of frozen desserts, because you don't want those rogue frozen dessert sellers out there, that's for sure. The Institute for Justice has done a nice job. They issued a nice white paper just this year in 2012 on this whole issue. They have numbers that are pretty similar to Wall Street Journal's, and they framed it in terms of this sort of core question, should you need the government's permission to work? And you can go to the IJ website, download the paper. It's a great paper. Next slide, please. So I want to finally conclude with a little bit of licensure laws and this interesting interplay between law of licensure and Obamacare. Obviously, Friedman could not have anticipated the specific form in which this would happen, but I think he spelled out the basic principles, and we're going to see them play out in our lifetime, and it will affect you as patients and me as a doctor, and it's not a pretty sight, so this is something to keep on your radar. And a lot of it is driven by this upcoming shortage of doctors caused by Obamacare. There's going to be a lot of reasons. A lot of doctors are thinking, wow, the practice of medicine is going to be much less fulfilling. There's going to be various economic factors that will drive more patients into the system, and there will be fewer doctors. And this will have some serious adverse effects on patients as well as on doctors. Next slide. So you may have just seen one of the articles, again, from last month in the Wall Street Journal. After the Obamacare law was upheld by the Supreme Court, health law survival means more demand for fewer doctors. And they said the US will be 60,000 doctors short in a few years, and then 90,000 doctors short 5 years after that. And to kind of put that in perspective, that's about 10 to 15% of the number of practicing doctors. So that's a significant shortfall. Okay, next slide. Just this past weekend, New York Times had this big article. Doctor shortage likely to worsen with health laws. I don't think it's likely, it's like inevitable. And they correctly point out that there's some bad stuff in the article, but this quote was a good quote. Experts describe the doctor shortage as an invisible problem. Patients still get care, but the process is often slow and difficult. In Riverside, California, which is where the article was set, patients are driving long distances to doctors, languishing on waiting lists, overusing emergency rooms, and even foregoing care. So as a patient, this should bother you, and this is because there are many routine medical services that can be handled completely competently and safely by what are called mid-level providers, nurse practitioners, physician assistants. They can do a great job with your flu shot, your sprained ankle, checking to see, do you have pneumonia, seeing did the baby swallow a George Washington quarter or not? And they can do a great job, and they're also very good at knowing when they need to kick it upstairs to an MD. Unfortunately, many doctors, the AMA for instance, the Colorado Medical Society, and most doctors I talk to actually are very opposed to allowing them to do too much of this. They want to have pretty strict supervision over the mid-level providers, and they use licensing laws and scope of practice laws to stop the mid-level providers from doing more. So they'll say, well, if you do this, that's practicing medicine. Only we can do that. You can't do that. Or you have to do that, but you have to check in with us on every case, etc. So the result, of course, the law of economics, increased supply, increased demand and not enough supply, longer waits for care. There will be an interesting impact on doctors, and that's because under Obamacare, more and more government funding and more medicine will be funded by the government, directly or indirectly. Already, Medicare, Medicaid, and government funding accounts for just about 50% of all healthcare spending. That number will go up as more private insurance company becomes essentially under government control. The insurance companies will be essentially semi-private utilities. And the problem is, Medicare and Medicaid pay really poorly. More and more doctors are refusing to accept Medicare and Medicaid because of that. Or maybe they won't refuse, but for instance, if you're a Medicare patient, they might see you, but they won't take a new one. Or they may have sort of a quiet percentage in the back of their head as to what percentage of Medicare patients they'll keep in their practice. And if they get to that point, they're not going to admit it to the government, but that's as many as they'll take, and they're in only private paying patients after that. So you're going to have a lot of patients who are covered, but they can't see a doctor because no one will see them. And you'll have a lot of unhappy government officials because there'll be unhappy voters. So what will happen, just to go back to just the left arrow. The government will be very tempted to compel MDs to accept these patients as a condition of retaining their license to practice. Next slide. This has already been proposed in the state of Massachusetts, which is sort of the proving ground for what we now call Obamacare. This is a headline from a couple years ago. Massachusetts to force doctors to accept lower rates or lose license. Now this is proposed. It was ultimately rejected by the state legislature, but the seed was planted. And you can be damn sure that legislators from the other 49 states, as well as at the federal level, took notice. They thought, wow, what a great idea. Let's make doctors see the patients on our terms. And so the bill that they talked about, S2170, would require physicians to accept 110% of Medicare rates for health insurance for small businesses. For physicians, acceptance of set rates would be as a condition of licensure. So, next slide, please. So basically, doctors are trapped by licensure. In the 1800s, they sought licensure as a special favor from the government. But the problem is, it's like accepting a favor from the Godfather. There are always strings attached. And licensure now puts doctors under the government thumb. There's another potential danger, which I've not seen too much of yet, but this is the one case that I've thought about, and I want to look out for this. This is the case of urologist Dr. Jack Castle in Florida. I think R.A. Armstrong interviewed him in Washington, D.C. a couple years ago, one of the Tea Party, because it's on R.A.'s blog. I've done a little bit of Facebook correspondence with him. So after Obamacare was passed into law in 2010, he spoke up pretty vehemently against the new law. And he was maybe a little over the top, and he made national headlines because he put a little sign on his office door saying, well, if you like Obamacare, maybe you should see a different doctor. Now, that got a lot of people upset. That got some congressmen upset, and Representative Alan Grayson of Florida basically tried to revoke Castle's license. He looked into him, filed a complaint with the medical board. That didn't really stick. He said, well, gosh, Dr. Castle, he's performing procedures in the Caribbean, offshore, outside of U.S. jurisdiction, using some medical devices not yet approved by the FDA. Maybe we should yank his license for that. Again, the Florida State Medical Board eventually did not act on that complaint, but the complaint was filed. Again, it's a little dangerous precedent. Maybe it's just an outlier, but you want to be careful that this doesn't become a trend. And Milton Friedman himself pointed out that in the 50s, the Texas pharmacy license, for instance, did require you sign a non-communism oath. So again, there's precedent. Again, that was the Cold War, everyone was anti-communist, but still, it's a little disturbing. So there are some free market reforms we can adopt that would move us in the right direction. Ideally, we would like to eliminate licensing laws. I know that won't happen overnight, but there are some good intermediate steps that I think would move us in the right direction as stepping stones towards eventual complete elimination. Shirley Savoni, who is an economist in California, she's written a nice paper on licensing laws and the problem, and one of the proposals she made was to allow increased scope of practice for mid-level providers. Small step, but a good step. One of my friends, Dr. Milton Wolf, another radiologist in Kansas City, he's on Fox News, and he's got daily color, he's a fun guy. He's suggested allowing medical licenses to be valid across state lines, just like your driver's license, and just like some concealed carry advocates want your handgun permit to be valid across state lines. That'd be great. That would, again, loosen up, it would eliminate some restrictions, loosen up the market. But the problem is medical boards like the Colorado Medical Board, that's precisely what they don't want. They don't want some yahoo from Texas coming in practicing in Colorado. But anyhow, to conclude, I want to just take these three take-home points. Milton Friedman was a superb advocate of eliminating licensing laws. He spelled out excellent arguments. For your purposes, patients and doctors will be increasingly harmed by them under Obamacare. And now is the perfect time to reacquaint lawmakers and our fellow Americans with Friedman's very good ideas on this issue.
All right.
Thank you very much.